Hi, my name is Hunter Kerrigan. Today I'm going to talk to you about celiac disease. I am aiming to cover what celiac disease is, signs and symptoms, effects, and treatments. First, let's establish what celiac disease is. According to Beyond Celiac, celiac disease is a serious genetic autoimmune disorder triggered by the consumption of a protein called gluten, which is often found in wheat, barley, and rye. Here I have my diagram of my wheat, barley, and rye. These are all grains which contain the protein gluten. I've also included oats, although they don't contain the protein themselves. They're often cross-contaminated. Farmers will produce wheat on one field, and the following year will use the same field to produce oats, which makes that whole production cross-contaminated and unsafe for people with celiac disease. About 1 in 100 people are diagnosed with celiac disease across the world. The most common misconception is that celiac disease is a fad diet or a way to promote weight loss, although there is options of removing gluten from your diet to increase or promote your own weight loss. Celiac disease itself is not a decision. It's something you're either born with or that you've developed throughout your life, and it's an adjustment after a diagnosis. In addition to being an autoimmune disease, celiac disease is also hereditary. People with first-degree relatives that have been diagnosed with celiac have a 1 in 10 risk of developing it themselves. It's often recommended that people get tested with either simple blood work or a biopsy. Now that we've established what celiac disease is, it's important to be aware of the symptoms. Symptoms actually develop by your body's own immune system launching an attack on your small intestine and your villi. I've got an image here. So this is your small intestine in your body. This is the image of the few layers, and then these are the villi. They are the finger-like substances that increase the surface area on your intestine for nutrient absorption. In a person with celiac disease, this is what the villi look like, and you can see here that the nutrients, instead of being absorbed like they should be up here when they're being ingested, they're actually bouncing back and there's no chance of absorption there. So this often leads to malnutrition. This damage and malnutrition is often related to other problems, including cancers, thyroid disease, osteoporosis, infertility, and other onset of other autoimmune disorders. If this is left untreated, people with celiac are at high risk for serious long-term health consequences. Diseases such as Crohn's disease, which is an inflammation of your intestine and other parts of your GI tract, type 1 diabetes, hepatitis B, dental enamel effects, dermatitis herpetiformis, which is itchy blisters or bumps on the skin, and multiple sclerosis are all more likely to be developed in those diagnosed with celiac disease. In addition to an onset of other autoimmune disorders, celiac disease is also linked to a deteriorating mental health. Patients with celiac disease see a 10 to 22% increased risk of neurological disorders reported. Finally, there is currently no treatment or cures for celiac disease. The only way to manage it is to follow a strict gluten-free diet, ingesting crumbs from a toaster, or if somebody is to butter a piece of bread and put that butter knife back in the butter, and if you were to ingest any of those crumbs, it can then trigger intestinal damage. It's really important to be aware of this cross-contamination aspect. It makes things like eating out difficult. Although a restaurant may advertise gluten-free food, it's very unlikely that they have a dedicated gluten-free facility to prepare the food or gluten-free fry later. If you have celiac and you try to order a side of fries, if they're in the same fry later as onion rings, which are breaded, unfortunately you can't have that due to the cross-contamination. Because if you do, it will trigger damage to your intestines, which just puts your process back even farther. In conclusion, celiac disease is much more than just not wanting to eat bread or carbs. There's a lot which entangles itself into the autoimmune disorder. It's certainly an adjustment being diagnosed with celiac, but being able to maintain and take care of it is extremely important and beneficial to the individual. I hope throughout the speech I was able to educate you on what celiac is, the signs and symptoms, effects, and treatments of it.